This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
It's called the wear and tear arthritis, and it affects millions in the different corners of the world. Osteoarthritis normally manifests later on in life. The longer you use your joints, the more likely you'll have this possibly crippling condition.
Pag sinabi kasing arthritis, it basically implies na may inflammation sa joint. Okay? Ngayon, maraming pwedeng cause ng joint inflammation. Ang pinaka-common, yung tinatawag na osteoarthritis, and usually it is degenerative in nature.
It can wreak havoc on the protective cartilage on the ends of your bones, mostly damaging joints in the neck, knees, lower back, and hands.
Ibig sabihin nun, as the years progress, yung wear and tear sa mga joints natin, that will include tuhod, yung balakang natin, yung cartilage eventually nagwe-wear out yan, nagti-thin out. And because of that, later on, nagkaka-irritation sa joints, nagkaka-symptoms yung patient.
Most of the signs are easy to spot, such as continuous joint pain and swelling and stiffness in the joints, especially after sitting or sleeping for long periods of time. And while there's no known method to prevent osteoarthritis, there are ways to manage and limit the symptoms. Key lifestyle changes are desired, such as ensuring that you maintain your ideal weight, exercising regularly, and even the use of canes and walkers can reduce the stress that you put on your joints.
So what are the things that you should do? Well, try to maintain an ideal body weight, diba? Kasi if you become overweight, pwedeng magkaroon ng thinned out cartilage. The other thing you want to think about is the opposite side, diba? Try not to overload your joints. There are some studies that show that even cessation of smoking will help you from, because it's still a risk factor.
How can you manage pain for osteoarthritis? Is osteoarthritis and rheumatoid arthritis one and the same? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Bernadette Hazel Manapat-Reyes, a rheumatologist from the UBPGH and fellow of the Philippine Rheumatology Association. Also joining us tonight is Dr. Mark Anthony Limson, an orthopedic surgeon at the Makati Medical Center, Manila Medical Center, the Medical City, and St. Luke's Medical Center Global City. He's also a fellow of the Philippine Orthopedic Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Doc Hazel, Doc Mark. Welcome to MedTalk.
Good evening, Angel.
Good evening, Angel.
Osteoarthritis. Doctors, osteoarthritis. How prevalent is this in the Philippines? How common is it?
Well, back in 2008, the society, the Philippine Orthopedic Association, had a study, I think, which was about prevalent in about 16% of the population, roughly about 11 million people. And not surprisingly, about 65, in the age 65 and above, 50% were found to have some signs of osteoarthritis.
Mm-hmm. Okay, so 65 and above. So it's talagang, as we get older, as we mature in age, it becomes more frequent.
That's
Yes.
right.
But before we get to that age, 65 and above, and it becomes more frequent, there's a natural aging process of our joints.
Oh, yes.
What is this, Doc Hazel?
When you look at the joint, you're really not just looking at two bones in close proximity. You have cartilage, which is the lining surface of your bones, such as this. Mm-hmm. If you eat fried chicken, that shiny thing at the tip of the bone,
Yes.
that's cartilage. Okay. Normally, cartilage is very compressive. It allows you to bear weight on the joint. When you get older, the composition of the cartilage actually changes. Cartilage healthy cartilage, that is, it's actually made up of what we call collagen type 2. I might be getting a little bit too technical here. And it's like strands hugging other molecules called aggregans. Aggregans are the ones that allow the water to come into the cartilage, giving it a little bit of bounce. So when you put weight on the joint, it doesn't really flatten, but it allows it a little bit of resilience.
Okay.
Now, when you get old, we used to think of cartilage as a very static tissue, like it's like a car tire. We used to think that it just fades away and gets thinner and thinner as you go along. But we realized later that cartilage is actually metabolically active, meaning when it gets injured, it tries to repair itself. However, like everything in life, it's easier to break down than to put back, right? So as you get older and older, the capacity of cartilage to actually repair changes such that it gets thinned out. The fibrils gets a little bit looser, and it's able to absorb less water, so the compressive element becomes less efficient.
Okay.
So that is normal aging, and that is why also we see osteoarthritis more frequently among the older patients.
Because the water in the cartilage, the water decreases, and then the cartilage
it's not able to hold that anymore.
Okay, so in osteoarthritis, what happens to the bone, the joint, the cartilage?
Okay.
Go ahead.
Dr. Hazel.
When we're looking at osteoarthritis, again, we have learned over the past decades that it's not just a disease of the cartilage, in fact, that in fact everything surrounding the joint changes with time, with trauma, with a lot of things, with weight bearing, and all of this become different in osteoarthritis. So osteoarthritis, basically what happens is that the protective mechanisms of your joints are altered. What are these protective mechanisms? We've talked about cartilage earlier. Another protective mechanism would be the muscles surrounding the joints. And you would know that when you get older, the muscles become weaker, so they're able to hold less of the weight. If you think about the physics of the joint, it's actually very interesting. Your knee, when you're standing on one knee, you're holding 3 to 6 times your body weight on that knee.
Okay.
So now you would know why the ligaments or muscles are very important. Now, our joints are so well designed that we have what we call mechanoreceptors in these ligaments and these muscles. They're able to micro-adjust every time we move our joints. You know the sensation when you're going down the stairs and then you miscalculate and then boom,
Yes.
your knee kind of falls badly? Without the mechanoreceptors, it's always going to be like that. So when you think about how infrequently that happens to you, you will really appreciate how efficient the mechanism is in protecting the knee. In osteoarthritis, that becomes less efficient and, well, in certain instances, lost. So it becomes the process wherein the intrinsic mechanism in your cartilage is damaged, and then the supporting structures also are not working as well as they should be.
So it's really the wear and tear of your knee, your joint.
It's being not able to adjust.
Yes.
I'd like to think of it like the roads along C5 now. So if you see there's a truck lane, right? And all the heavy trucks are passing along it. If you compare the road there and the road beside it, look at the road where the trucks pass. Because of the heavy load and the cement not able to adjust, you got potholes over just that lane. I'd like to think of the knee something like that.
Oh, that's a very, what word should I use?
It's a very simplified version.
Simplified version or simplified image that you've painted for us
But
to
you
understand it a lot better.
Mark is actually moving away from characterizing it as a simple wear and tear, because the joints are a very dynamic organ, and we're likening osteoarthritis as an end-stage condition. So in the same way you have end-stage renal disease,
Yes.
you have end-stage heart, this is like an end-stage joint condition. Well, of course, when it's in its
In that-
extreme.
Yeah.
In the
Yes.
last stages. Yeah.
So it's also a stage. The disease also goes through certain stages.
Yes.
It
Just
does.
like what you've mentioned, renal disease or any other disease that has, that
Yes.
goes through a lot of stages. You've mentioned appreciation for the function of our joints. as human beings, no, we tend to neglect certain body parts or certain functions, and we tend to focus on maybe aesthetics or maybe what's more important to us. No,
Yes.
iba-iba naman yan per individual,
What
per
makes you
patient.
happy.
What makes you happy? Exactly. So how do you educate your patients to appreciate? You've mentioned, no, appreciate the function of your joints, so it doesn't lead to OA, osteoarthritis.
Unfortunately, it's like you never know it until it's gone. So if you can't use it, that's the only time you really appreciate it.
Okay, you won't know it's how important it is.
Yeah.
But I would like to think that's the reason why we do programs like this, because we need to remind people that the normal function is a lot of times almost perfect as it is. If you can imagine everything that can go wrong with your body and it doesn't go wrong, then you would understand why it's important to take care of this of your body. And for younger people, I think it's very, very important to get a knowledge of osteoarthritis, because, you know, it's probably not a glamorous arthritis to have, but among the different arthritides, this is the one that you are more likely to have because it's the most common. And people don't think about it, as Mark says, until it's gone and it's there. But if we want to take care of our joints, we need to start taking care of them fairly early.
And we don't think about it because we always associate osteoarthritis with the older...
Old age.
Yes, that's true.
With old age, yeah. I'm not going to get it in my 20s, nor in my 30s, maybe not even in my 40s.
That's true.
Because I'm not yet 55, 65 and above.
That's true.
The causes of osteoarthritis, does it cut across age, gender, lifestyle?
Although
Doc Mark?
although it's more prevalent in the elderly population, it is also more commonly found in obese people and the female sex.
Female.
Yes.
What
the
is
female.
it that the female body structure has that makes us more prone to OA?
There's actually no clear reason why it's more common among females than males, because when you compare the mechanics for older women versus older men, there's really not much of a difference. So one of the things that always gets blamed is hormones. Yeah, but how exactly that works is really not clear. Yeah, so Mark made mention about age, gender, obesity. Interestingly enough, you would think that obesity is just a loading problem. You carry more weight, therefore there's more stress on the joints.
Yes.
But there are studies that show that for obese patients, it's not just the knees and the hips that can be more affected, but hands as well. And hands are non-weight-bearing joints. So we're looking at obesity being a state of low-grade inflammation. And in that state, in obesity, you actually produce adipokines. These are substances that can induce inflammation and can cause pain in your joints.
Okay, so yes, Doc Mark.
No,
you
and I
wanted to
think
add?
recently they've also been trying to find the gene
Yes.
which is connected to osteoarthritis. However,
Okay.
they have not really identified which gene it is. So,
And in
it
this day and
remains-
age of modern science, there's, I understand, genetic testing that can be done, and maybe, you know, we can find out.
What is
Find that
done
gene.
is what we call genome-wide associations, and there's actually two. One is growth factor abnormality gene, and one is COL2A gene that's associated with hand osteoarthritis. But yes, it's not very clear that I test you for this, therefore
Yes.
you will have osteoarthritis. It's not that straightforward. I mean, not clear, straightforward.
We've talked about a little bit about hand osteoarthritis. There are other different types of osteoarthritis,
Yes.
and there's, from what I understand, primary and secondary type of osteoarthritis. We'll talk about that and more when MedTalk returns.
Did you know that wearing high heels on a regular basis may increase your risk of developing osteoarthritis on the knees? Not being able to stand up straight may cause excess stress on your knees. So, limit wearing those high heels and reserve them for special occasions only.
We're back here on MedTalk, still talking about osteoarthritis. This time, Doc Hazel and Doc Mark, we have a caller on the line, Gina. Hi, Gina. Good evening.
Good evening.
Please go ahead with your question.
Okay, yes. Lately I've been having pain in my knees, and then I also feel like whenever I extend my knees, there's parang mga sand or buhangin. So what I did, I went to St. Luke and I got a consultation from a doctor. He told me to get an X-ray and also for the meantime to take collagen capsule and the fish oil, which I've been doing. Just last week I got my results and the findings was I have osteoporosis.
Gina?
Yes.
Hi, can you please repeat the last part?
I got the results of the X-ray
Yes.
and the findings was I have osteophytosis of the patella.
Okay, awesome.
So I just want to know what that is. Although I researched about it and it said it's like bone spurs, but I want to know what the treatment or what I can do.
Okay, thank you, Gina.
How old are you, Gina?
I'm 46.
You're 40. Wow, that's fairly young.
You have pain
My mom got a total knee replacement just early this year, so I'm kind of paranoid.
Okay.
You have pain going down the stairs?
No. Sometimes I'm more of going down when I go down the stairs, but now I avoid using the stairs because I just don't want to make it worse.
Okay.
Gina, you were mentioning there's a sound in your knee when you move it. It's like a gritty sound.
Buhangin, just a sand.
Yes, okay. So it's a gritty sound that you hear. Okay. And you have pain most days of the month on that knee?
Not always, not always. It's like when suddenly when I just sit down on the floor, that's when I feel it. But not always.
Okay. Okay.
Go ahead.
When we have knee osteoarthritis, actually there's 3 compartments in the knee. The medial part of your knee, the lateral part or the side of your knee, and the portion between your kneecap and the bone, your patella and the bone. From what I understand, it seems like you have osteophyte or excess bone formation in the patellar surface and that you have difficulty negotiating stairs. So, and then what the gritty sound is what we call crepitus. Okay? If I got that correctly from what you've told me. If you have pain on most days, you have crepitus of the knee, and then the doctor has seen osteophytes in the patellofemoral area, then it might be likely that you would have patellofemoral osteoarthritis. Okay? I think the reason why we reacted, because you're 46, that's fairly young, right? May I ask if you exercise, if you've injured the knee before?
I never injured my knee. With regards to exercise, I love to go morning, but no regular exercise.
Okay. And so usually in situations like that, what we try to handle would be the patient's complaints. So if it's the pain, then the doctor is probably going to address that for you. But if it's function, like negotiating stairs, he probably would recommend some forms of exercises or a consult with the physiatrist for you to strengthen the muscles in your thighs, because that's going to help your knees later. Okay? the reason why we ask about exercise or injuries before is that it's one thing that might predispose you to have osteoarthritis early.
I
Okay.
definitely agree with that.
The doctor that I talked to also recommended that he could inject something in my knee, but he said we'll wait for the results first for the X-ray. But he did do something about injecting something in my knee and it would make it better.
Okay. Usually these injections are two kinds. You either inject it with a corticosteroid or a steroid for your knee, or sometimes you use what you call viscous supplementation or hyaluronic acid. Both of them have been used for osteoarthritis. But if you talk about the latest guidelines, the hyaluronic acid or the viscous supplementation, according to the American Academy of Orthopedic Surgeons, they are strongly not recommending it. However, for corticosteroid, they have no, they cannot decide with finality whether it's really good for you or it does nothing for you.
Usually also, Gina, these treatments are reserved, the injectable treatments, if there is swelling in the joint. But if your problem is just occasional pain and function, maybe that's what we should focus a little bit more on.
So I guess the best thing to do is bring the results.
Yes,
To
bring
my
the results
doctor.
to the doctors.
Yes.
Okay.
Okay. Thank you, Gina.
Okay. Thank you.
Thank you very much. Take
Okay,
care.
bye-bye.
Bye-bye. Doc, Gina mentioned also taking collagen capsules or was it recommend collagen and fish oil? What can you say about that?
Collagen and fish oil are not in the recommendations of the Philippine Rheumatology Association, also in the guidelines of the European League, also in the NICE guidelines and the American College of Rheumatology guidelines.
Okay.
When we talk about guidelines, we basically recommend interventions that have a very, very clear benefit to risk ratio or benefit to cost ratio. So I think that the short answer there is that it's hard to recommend them because, especially if there's a third party payer, if these are not part of what is evidence-based,
Okay.
then probably you can use them as supplement, and of course if you feel better on them, that's fine and good, but usually we don't really write them out as drugs.
My take on that is that they're just supplements. As you
Yes,
said, they are
okay.
not recommended by any of our groups that are authorities on these particular subjects.
Okay.
So what I tell my patients is that if it makes you feel better, go ahead, well and good, especially if they're free. But if you need to buy them and it does nothing for you, then you're wasting your money.
Okay, all right. Thank you for clearing that up, for giving us your take on that. Doctors, this time let's go to the common types of osteoarthritis or the regions of our body which
Yes.
are more prone to osteoarthritis. Let's start from head to toe.
Head to toe.
Which part of this area? Kasama
Yeah.
ba yung nape, Doc?
The
Bata?
cervical,
Cervical,
yes, the
okay.
cervical spine.
Okay.
Sometimes the thoracic, but more of, yes, the lumbar spine.
Lumbar spine,
Okay.
which is that one.
Right
This
there.
one, okay. So the lumbar spine, what exactly happens to the lumbar spine and how is it affected when one has osteoarthritis, Doc Mark?
Okay, when you have the osteoarthritis of the lumbar spine, I think it's probably more prevalent because this part also carries most of the weight of the body. Okay, now as you know, there are multiple joints on the spine.
Okay.
Each of these joints are capable of developing arthritis. Okay, now when that happens, you get what you call osteophytosis or sometimes bone spurs.
yes.
Okay. Now these bone spurs are the body's attempt to regenerate or to repair.
Okay.
Okay. When that happens, you get your excess bone. Now what this excess bone does is that it closes or narrows the space allowed for your nerves, which may sometimes translate to difficulty walking, or sometimes you might have pain down one side or both sides of your legs.
Okay.
Yeah.
But
Okay.
yeah, that's really very interesting with cervical and lumbar spondylosis. A lot of instances, if you do x-rays, especially in the older patients, you would see some changes, but they'd be asymptomatic. The symptoms start coming when you have the nerve irritation, as Mark has said.
Okay, so the spurs come out. It's an outward growth
Yes.
that irritates, or
It's supposed to be, the hole where the nerves are coming from is supposed to be perfectly smooth, but it gets roughened up a little bit. And
we hear a lot of that common complaint in the.
Because it feels terrible.
Yes, from what I understand, yes, even the spurs on your feet, it makes it difficult for you to walk.
yeah.
Sorry, but that is actually a misconception.
Oh, okay. All
That
right. Thank you for
spurs,
clearing that up.
yeah.
Yes. The
That's-
outward growth of the
Yeah.
bone on your feet makes it difficult for you to walk.
Yeah, you always see patients that say, Doc, I have a bone spur in my heel, that's why it's difficult to
Yes.
walk.
Yes.
That bone spur is actually what you call an ensenophyte. It's actually a calcification of the tendon underneath, which is a result of the problem.
Okay. All right.
Okay.
So we've talked about
And
the
also,
yes, Doc
ankle
Hazel.
osteoarthritis is very uncommon.
Okay. Very uncommon.
Very uncommon.
All right. So what is what is more common in osteoarthritis? What is the common?
Basically, the most common would be your knees, the
Okay.
hips, the hands, and the spine. Why is it like that? And also the first CMC joint here and the joints here in the hands.
Okay.
Why is that? Evolutionarily, we started out as quadrupeds. So now when we assume an upright position, the loading in the joint in this area specifically become different. So they're the ones that become symptomatic. So not all joint pains, and then you have an X-ray finding of a spur means
Yeah.
it's osteoarthritis.
Arthritis.
I think that's the point
Yeah.
Mark also is trying to make.
Okay. So we've mentioned the spine. We go from head to toe, the spine, and then which other
The cervical and the lumbar spine.
Okay.
The knee, we touched on that earlier. So in the knee, you have 3 compartments. In the middle knee, or your medial compartment, the lateral compartment, and the patellofemoral. Basically, they're alike, except that when you have deformities in one area more than the other, then your joints become malaligned in a specific way. Like if you have the deformity basically in the medial part of the knee, you get varus deformity or sakang.
Okay.
If the problem is on the lateral, you have knock knees or your valgus deformity or
Pique.
pique.
Okay.
Oo.
Okay.
Okay.
So these are the obvious signs that
These are actually late signs.
late
Yes.
signs already.
These are late signs already.
Okay.
When you start getting deformities, start walking the wrong way, then these are late signs of having assuming it is arthritis.
Arthritis.
Okay.
Or even in the hands, the stiffness or the inflammation, when it becomes crooked, these are late signs already.
You have a lot of patients who would actually have bony enlargements in the PIP and the DIP joints. And here, your first carpometacarpal joint. However, they will not have symptoms. It's just a little bit enlarged. So if you do an X-ray, there's going to be a finding, but until it becomes symptomatic, we don't like to label it as osteoarthritis because it leads to people taking medications when
Yes.
medications are not necessary.
Okay, Doc, we'll talk about the symptoms of osteoarthritis when MedTalk returns. We're back here on MedTalk, still talking about osteoarthritis. You may join the discussion by calling our hotline at 548-4678. Doc Hazel, Doc Mark, we have another caller on the line, Ande Roque. Good evening, Ande.
Yes, good evening.
Please go ahead with your question para sa mga doktor natin.
Opo, doktor,
Yes po.
yeah, medyo nahihirapan po ako umakyat at bumaba na hagdan, both knees. Kailangan po isa-isa ang hakbang. Ano po ba magandang gawin?
Ilan taon na po kayo?
67 na po, doktor.
67. Okay. Mas nahihirapan po kayo dahil masakit o dahil mahina?
Medyo hindi naman po masyadong masakit, pero kaya naman po, kaya lang mahirap. Kaya isa-isa ginagawa kong
Isang hakbang
pagbaba
at
at saka pag-akyat.
Okay.
Pero nakakapaglakad pa po, nakakapag-golpe.
Wow,
Wow,
okay.
nice.
Nakapag-what? Sorry.
Nakakapag-golf.
Golf.
pa si
Golf,
Sir.
okay.
Still able to.
Tama po yung sinabi niyo, no? Marami po talagang patients that they're able to walk on a straight po, pero mahirap po yung akyat panahog ng hagdanan. Kasi medyo marami pong kailangan na muscle power para mag-akyat manaog din po tayo ng hagdanan. So, given po your age and that difficulty, ako po siguro the most that I would advise you for now is to have yourself evaluated by our arthritis specialist. Hindi po kasi simple ang paggagamot sa rayuma. There's more than 200 types of arthritis. And the medication has to be appropriate for you. At the age of 67, kuminsan po, marami na rin kayong ibang iniinom na maintenance. And those have to be taken into account when the doctor gives you medications if needed for arthritis.
Yes.
Okay. Doc Mark?
No, that's fine.
That's fine. Okay. Andy?
Yes, opo.
Oo, may tanong ka pa para sa mga doktor natin?
Pwede pong makakuha lang ng pangalan ng doktor para mapuntahan.
Okay.
Okay po. Yes,
At the end of the... okay.
Andy?
Opo.
Oo. May tutulong sa'yo to naibigay yung mga pangalan ng doktor natin at saka yung mga contact details nila.
Salamat po.
Salamat din.
Thank
Take
you
care.
po.
Walang
Salamat.
anuman.
Okay.
Salamat po.
Okay. He still plays golf, so it
Yeah,
doesn't
that's
hamper his
perfect.
activity.
That is the way to do it.
That is probably why there's no pain because he's playing
Yes.
golf.
Oh, nice. Okay, so
Yes.
that can be a solution. That can be an exercise.
Yes.
Okay.
Yes.
Probably the reason why he can function so well is because he's physically active. And sometimes patients would say that, should I stop? No, if you can't do it, just keep on doing the activity.
Okay, so golf is good.
Yeah, it's the walking in golf.
It's the walking in golf that is good.
Brisk
Okay.
walking.
Brisk walking in golf.
Brisk
Okay. It doesn't how do you call that? Bring weight to your
Load your knees too much.
Your knees too much.
No, not
No
really.
pressure on your knees because it's just brisk walking. It's not running or any other
Yeah,
activity
what
that
we
will
usually don't want
weigh it
is
down.
high impact.
Yeah.
That's what we don't want.
Okay, since we're on the topic of activity, before we go to the symptoms, what activities are recommended for those who have osteoarthritis?
For patients who actually have established osteoarthritis already, for instance, in the lower extremities, Mark and I were talking about this earlier, water aerobics or swimming would be good because you don't bear weight
Okay.
and you're able to do both your cardio and your muscle strengthening exercises.
Yeah. Helps a lot with your flexibility.
Okay.
And the second exercise, which we love, is biking.
Okay.
Okay.
All right. So leisurely biking, not competitive biking.
No, not competitive
Yeah.
biking.
Okay. Biking indoors is fine.
Biking indoors is okay.
It's fine, yeah.
Usually you want to limit it to about 30 minutes to about an hour.
Okay. How about we're seeing on the video jogging, like light jogging. Is that okay?
Yes, it's not bad, but if you have an injured knee, okay, and you start jogging, it might actually increase the risk further for developing osteoarthritis later in life.
Okay.
Yeah, but recreational running in itself does not really increase your risk for knee osteoarthritis. Again, it's individualized. Exercise is not supposed to make the pain worse. Okay, so if like that lady we saw on the video, she looks very happy doing
Yes.
her run.
Yes.
Yeah, so I think that's fine for her.
So you've recommended exercises. About exercises to avoid when you have
High impact
osteoarthritis.
aerobics.
Dancing. That's a high
Depends
impact,
on the
no?
kind of dancing that you're
Okay.
doing. Okay.
Okay.
We usually, well, I would want to recommend actually the simple types like yoga, Pilates, Tai Chi is very good.
Yes.
Okay.
Because these not only help strengthen your muscles, they help you with your balance as
Yes.
well.
Okay.
And your flexibility.
Do these activities also strengthen our bones?
Yes.
Yes, they do.
Okay.
Okay.
So yoga, Tai Chi, Pilates is
Yes.
recommended.
Okay.
Okay. Doctors, now let's go to the symptoms of osteoarthritis. What are some of the symptoms that one will have when one has, or is leading to osteoarthritis? Doc Hazel.
The cardinal symptom would be joint pain.
Okay.
So that would be not just maybe in the beginning it's pain that is increased with activity. Like, you know, a lot of patients would say, okay, I'm fine walking in the mall, I went on a pilgrimage and then my knees hurt because the activity is increased. But later on, it becomes more frequent and that the pain comes almost daily. Okay, so it's really a chronic persistent pain. The other one is what we call gelling in the knees. Okay, gelling is when you wait in your doctor's waiting room for some time and then when you get called by Dr. Mark, you have difficulty standing up already because the knees feel a little bit stiff. Another obvious thing or sign you would see would be bony swelling. So in the hands, you would see bony enlargement, especially in this area, in your DIP joints, and sometimes squaring of this joint. In the knees, I tell my patients who are elderly, remember what your knees look like when you were 30? They don't look like that anymore, and it's really because of the bony swelling in the knee joints.
Okay.
That's the usual. Sometimes a patient with osteoarthritis can also have fluid in the knee, so the knee gets grossly swollen.
Diffusion.
So that's called a diffusion, and that's a different issue altogether.
Okay. Doctors, we have another caller on the line. Lulu Tingson. Hi, Lulu. Good evening.
Hi, Miss Jacob.
Hi, good evening po.
Good evening po. Hello.
Opo, Lulu. Please go ahead with your question.
Okay. Hi, 66 years old na po ako.
Opo.
And I'm overweight. Obviously, I'm overweight. Ang naging problema ko po, lately lang po, siguro mga 1 month pa lang. Napakasakit po lagi yung tuhod ko, yung aking left knee. And medyo, there was a time na magapa siya kasi there was some reddish things on the knee. Right now, talaga pong hindi ako ang pinakalakad ko lang ko from sa kama, sa bed, and if we go to the mall, I use a wheelchair, tapos naka-cane po ako. Ngayon, nagpa-check up na ako. Ang sabi sa akin, hinunan po ako ng blood test. Wala daw po akong arthritis. Wala din daw po akong gout. So, ano pa kaya? Binigyan lang po ako ng pain reliever, Dolcet.
Okay.
Ano po kaya ito? Hindi ko na po alam eh.
Okay.
All right.
Ma'am Lulu, you're 66, right?
Opo.
Tapos swollen knee. Yun po yung pinag-uusapan natin kanina, that sometimes you get swelling in the knee with osteoarthritis. Wala po kasing makikita sa blood test. No, wala pong blood test that will tell you you have osteoarthritis. I think the doctor did the blood test to check kung meron po kayong ibang klaseng rayuma. So baka po kung talaga pong may tubig yung tuhod nyo, it will be a good idea na kuhanan po siya ng fluid for 2 reasons. Number 1, it's going to relieve the pain. Number 2, we will be able to ascertain what type of arthritis that you would have. Kung po kasi talagang namamaga yung joint ninyo at may fluid po siya, you might require other forms of medication outside of pure analgesia o yung gamot para sa kirot lang po.
That's true.
Okay. Yeah, I agree. The blood test will probably try to rule out kung pong merong infection, kung sakasakali, kung ang iniisip po nung inyong doktor ay may infection sa inyong tuhod dahil namumula, mainit at namamaga. Pero yun nga po, ang pinakamaganda po talagang gawin kung yun po ang iniisip nila ay kumuha po ng fluid po sa inyong tuhod para po mapasuri, para malaman kung ano po talagang sanhi ng inyong nararamdaman.
Naku, hindi ko narinig. Ano ba yan?
Doc Mark, do you
Okay.
mind repeating?
Ang sabi ko lang po ay yung pong dugo ay yung po siguro pong para maisabi na wala pong infeksyon or hindi po infeksyon ang dahilan. Isa po yun sa mga dahilan siguro po kung bakit kumuha ng dugo. Pero ang mainam po sana ay kung ang iniisip po talaga nila ay may problema sa tuhod na ibang klaseng arthritis ay kumuha po ng sample para po mapasuri, para mabigyan po tayo ng ideya kung ano po yung sanhi na pinagmumulan po ng inyong sakit.
Opo.
Sige po. Thank you po.
Okay.
Thank you
Hello,
po.
Miss Akop.
Opo.
Sana gusto kong makuha yung names ng mga doctors niyo.
Opo, our staff po will give it to you pagbaba po ng phone.
Opo. Thank you so much.
Salamat din po. Take care.
Opo. Good night.
Good night. Doctors, before we cut to a break, she mentioned the blood test, and you've mentioned that it's to determine if there's an infection, but not necessarily to target.
It's not always.
Not always osteoarthritis.
I think because she's an elderly female and it's a new arthritis, swollen knee, maybe the doctor was concerned that it's gout.
Okay.
Maybe the doctor checked her for uric acid. The other thing that because she's female, it's a swollen knee with an effusion. The other thing would be the inflammatory arthritis types of disease. So it might have been what the doctor would have checked her for. But there's really no test, kasi a blood test that will tell you what you have is osteoarthritis. So we go by the clinical symptoms. But I agree with Mark that if you're worried about an infection of the joint, if you want even to find out if there's really uric acid crystals or if it's an inflammatory type of arthritis, the most direct way of doing it is just to aspirate the knee.
Yeah, but of course, it has to be something that is, you don't inject everybody that has a
Yes.
swollen knee.
Okay.
So you aspirate,
Okay.
iba yung aspirate sa inject.
Okay.
Okay, what is the
or
difference?
aspirate, sorry, aspirate.
How
or
do
get
you-
samples.
You get some.
Okay.
Okay.
You don't do that for everybody that has or has a swollen knee.
Okay. So
Okay.
iba-iba talaga per patient.
Per
no?
patient.
Yeah.
All right. Okay. You've mentioned iba-ibang klaseng rayuma. We'll talk about that when MedTalk returns.
Be extra careful in exercising, especially if you are overweight, since you may put excessive stress on your ankle and knee joints. You may simply start off by climbing stairs and doing lightweight training to shed off those extra pounds.
We're back here on MedTalk, still talking about osteoarthritis. Doctors, iba't ibang klase ng rayuma. You've mentioned that, you've discussed that with our caller earlier, Lulu. So what are the most common or the more common types of arthritis?
Okay. The most common type is still osteoarthritis, but the other common types of arthritis that we would see would be gout. Okay, that is the arthritis that is associated with an elevation of uric acid. A lot of patients think that if it's rayuma, it's because of uric acid. So a lot of patients would say, I don't eat munggo because I have rayuma.
Yes.
In fact, uric acid is only associated with gout. It's a totally
okay.
different disease from osteoarthritis. The other thing that people confuse with osteoarthritis would be rheumatoid arthritis kasi rheumatoid rayuma, parang ganon.
Yes.
There's
But
a real misconception there, right?
Yes, yes. It's a big misconception, but in fact, rheumatoid arthritis is a totally different arthritis. It's an autoimmune process. The arthritis is inflammatory in nature. Osteoarthritis is more mechanical in nature, although you can have a little bit of inflammation thrown in also. In rheumatoid arthritis, generally a lot of joints are involved. Usually more than 4 joints are involved. And joints that are not frequently affected in osteoarthritis can become affected in rheumatoid arthritis. Case in point would be your wrist joint, and then your metacarpophalangeal joints. That's very common in rheumatoid. It's important to differentiate because the treatment is grossly different.
Okay. So treatment for RA, you're excused, RA and OA, you're excused, doc, is totally different.
Totally different.
Even the joints that are affected in rheumatoid
Some
arthritis
joints
and
are
osteoarthritis.
commonly affected, like the knees, pwedeng osteo, pwedeng rheumatoid, the PIP joints or these joints can be affected, the hips for instance, but it's important to differentiate because right now we have so many drugs for rheumatoid arthritis. We really would like to look at it as a medical condition, and the earlier that you're able to get consult and that you're able to get appropriate treatment, the better your chances of going into remission as far as rheumatoid is concerned.
Okay. Doctors, we have another caller on the line, Arnold Soriano. Good evening, Arnold.
Hello, good evening.
Yeah, hi, good evening.
Yes, gusto ko sanang, I would like to inquire lang, yung pamangkin ko, she's female, mid-30s, na-diagnosed with degenerative arthritis ng MRI. And, hello?
Opo. Yes.
Ano ho ba yung, kasi she was operated before. Doon din sa area na yun, may nag-protrude yata ang bone. Na-correct na. And, would it be, kung hihingi kami ng second opinion sa inyo for consultation?
Okay, yes.
Sorry po, ilang taon na po yung pamangkin nyo?
Hello?
Oo, Arnold.
Ilang taon na po yung pamangkin nyo?
Mid-30s ho.
Okay.
Tapos,
Female.
inoperahan na po siya?
Mid-30s.
Opo, naoperahan na po siya?
Nagkaroon lang ng protrusion sa sacral-lumbar area. Binawasan yata yung, hindi ko alam yung medical term eh.
Okay.
Desiccated ba ang tawag doon? Then, sa MRI niya, merong degenerative arthritis. Pero wala na ibinibigay na ano or walang ano ho. Mo-monitor lang daw.
Ay, palagay ko po yung nakaprotrude na yun po ay disc.
Disc.
Based on the MRI.
Na-correct na yun ho. How about the degenerative arthritis? Meron bang, di ba, yung treatment or prevention or how to delay the degeneration?
Of the disc po?
Along the, nakalagay degenerative arthritis yung MRI sa lumbosacral area.
Okay.
And would it be right to ask kung pwedeng humingi ng second opinion for...
Okay.
Pwede naman ho sa consultation.
Okay. Well, number one po, it's very rare that we get a degenerative arthritis of your back at such a young age, or 30.
Oo nga eh.
Now, there might be some predisposing factors, of course. Now, the disc there,
Siya nag-office.
the protruded disc there might be the one causing problems for, ayun po siguro yung nagkakos po ng problema sa inyong, sa inyong pamangkin.
Nabawasan ho.
Alright? That's also that's a different topic from what we are discussing of arthritis. That might be a slip disc kung tawagin, which happens also in very active na mga tao, mga 30 po. Now, we cannot give a good second opinion unless we have seen the patient po.
Yun nga ho, Doc. Yun nga, kung pwede, can I ask your clinic?
Opo, Arnold, yes. Our staff will give you the contact details of our doctors.
Yes.
Opo, yes. When bago niyo po ibaba yung phone, they can give you the contact details para po makakonsult kayo sa doctors.
Hello, ma'am?
Yes po.
Wala ho ako sa TV kasi yung phone malayo sa TV. You are Dr. Reyes ho, ano ho?
Opo.
Can we go for a second opinion sa inyo ho?
Opo.
Na ho?
Yes.
Yes. Sige po.
Dr. Bernadette Reyes ho?
Opo.
Yes, Arnold. Dr. Reyes, Doc Mark will give your contact details
Yes.
to Arnold. Salamat po, Arnold. Thank you. Okay, so that was an entirely different topic.
Yes.
Slip disc.
Yeah.
We can have that one. in our future episodes.
I'll be happy to be the patient.
Mark talks with so much compassion
Yes,
about
yes,
it. I think he understands what it's like.
Oh, I empathize, believe me.
Oh, you do, Doc Mark. Okay. You know, we've mentioned so many facts and so many. We've given a lot of information to our viewers on rheumatoid arthritis. I don't think we've tackled diet and age. What should we avoid prior to, you know, we age, okay, we love to eat, Filipinos love to eat. Are there certain types of food that we should avoid so that it lessens our chances of getting OA?
I think the viewers will be happy because her answer is no, you don't need to avoid specific foods, but you really need to try to keep to your ideal body weight.
Okay.
I'd probably say you should stick to the food which your cardiologists tell you.
Yes.
Away from the fats, away from the high carbs, lots of fruits and lots of vegetables.
Yum. That sounds good. Everything in moderation. We always say
Everything in moderation.
Everything
That's
in
right.
moderation. Prevention, doctors, as a final message to all our viewers. Let's start with you, Dr.
Prevention for younger people, we always advocate exercise for younger and older people. It's important to keep your joints healthy. It's important to avoid injuries by doing your exercises properly. We advocate exercise because if you keep to your ideal body weight, it also lessens the risk of developing symptomatic osteoarthritis.
Okay, thank you, Doc Hazel. Doc Mark?
I think that osteoarthritis is not just a problem for the person himself. I think the problem also goes across borders. It's both social, economic, emotional, and so family members have a great contribution to this. I think they should be able to give support, be willing to learn what the disease is, be willing to understand how the relative feels, and to be able to give support during doctor's appointments, and basically be there when during the good times and the bad times of arthritis.
Thank you very much, doctors. And during the good times and the bad times, they can call you, get in touch with you, consult with you, and see you.
Of course.
For more education, for more information on how to appreciate and understand our body, most especially our joints and our bones, better.
Yes.
Thank you once again, Doc Hazel, and thank you, Doc Mark, for your time.
Thank you.
Thank you. We'll see you again next Tuesday. Oh, we'd like to thank our callers also for joining us on the show. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation here on 9TV. This is Angel Jacob. Good night.
Joint. Okay, ngayon, maraming pwedeng cause ng joint inflammation. Ang pinaka-common, yung tinatawag na osteoarthritis, and usually it is degenerative in nature.
It can wreak havoc on the protective cartilage on the ends of your bones, mostly damaging joints in the neck, knees, lower back, and hands.
Ibig sabihin nun, as the years progress, yung wear and tear sa mga joints natin, that will include tuhod, yung balakang natin, yung cartilage eventually nagwe-wear out yan, nagti-thin out. And because of that, later on, nagkaka-irritation sa joints, nagkaka-symptoms yung patient.
Most of the signs are easy to spot, such as continuous joint pain and swelling and stiffness in the joints, especially after sitting or sleeping for long periods of time. And while there's no known method to prevent osteoarthritis, there are ways to manage and limit the symptoms. Key lifestyle changes are desired, such as ensuring that you maintain your ideal weight, exercising regularly, and even the use of canes and walkers can reduce.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
It's called the wear and tear arthritis, and it affects millions in the different corners of the world. Osteoarthritis normally manifests later on in life. The longer you use your joints, the more likely you'll have this possibly crippling condition.
Pag sinabi kasing arthritis, it basically implies na may inflammation sa joint.
Actually changes. Cartilage, healthy cartilage, that is, it's actually made up of what we call collagen type 2. I might be getting a little bit too technical here. And it's like strands hugging other molecules called aggregans. Aggregans are the ones that allow the water to come into the cartilage, giving it a little bit of bounce. So when you put weight on the joint, it doesn't really flatten, but it allows it a little bit of resilience. Now, when you get old, we used to think of cartilage as a very static tissue, like it's like a car tire. We used to think that it just fades away and gets thinner and thinner as you go along. But we realized later that cartilage is actually metabolically active, meaning when it gets injured, it tries to repair itself. However, like everything in life, it's easier to break down than to put back, right? So as you get older and older, the capacity of cartilage to actually repair changes such that it gets thinned out. The fibrils gets a little bit looser, and it's able to absorb less water, so the compressive element becomes
The stress that you put on your joints.
So what are the things that you should do? Well, try to maintain an ideal body weight, diba? Kasi if you become overweight, pwedeng magkaroon ng thinned out cartilage. The other thing you want to think about is the opposite side, diba? Try not to overload your joints. There are some studies that show that even cessation of smoking will help you because it's still a risk factor.
How can you manage pain for osteoarthritis? Is osteoarthritis and rheumatoid arthritis one and the same? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Bernadette Hazel Manapat-Reyes, a rheumatologist from the UBPGH and fellow of the Philippine Rheumatology Association. Also joining us tonight is Dr. Mark Anthony Limson, an orthopedic surgeon at the Makati Medical Center, Manila Medical Center, the Medical City, and St. Luke's Medical Center, Global City. He's also a fellow of the Philippine Orthopedic Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Doc Hazel. Doc Mark, welcome to MedTalk.
Good evening, Angel.
Good evening, Angel.
Osteoarthritis. Doctors, osteoarthritis. How prevalent is this in the Philippines? How common is it?
Well, back in 2008, the society, the Philippine Orthopedic Association, had a study, I think, which was about prevalent in about 16% of the population, roughly about 11 million people. And not surprisingly, about in the age 65 and above, 50% were found to have some signs of osteoarthritis.
Okay, so 65 and above. So it's talagang, as we get older, as we mature in age, it becomes more frequent.
That's right.
But before we get to that age, 65 and above, and it becomes more frequent, there's a natural aging process of our joints. What is this, Doc Hazel?
When you look at the joint, you're really not just looking at two bones in close proximity. You have cartilage, which is the lining surface of your bone, such as this. If you eat fried chicken, that shiny thing at the tip of the bone, that's cartilage. Okay. Normally, cartilage is very compressive. It allows you to bear weight on the joint. When you get older, the composition of cartilage, the cartilage